Okay, I've been sitting up here nervous about the drop off. So I'm glad everybody here is a healthcare professional. So if I go down, you got me, right? My panelists? Okay, great. My name is Keith Jones, and let's see. Okay, I'm pressing it. Can you advance the slide for me? Nice to meet you. So my name is Keith Jones, and I work at Mayo Clinic, and I support staff well-being efforts there. Today, I'd like to talk to you about a novel well-being intervention that we introduced at Mayo Clinic to support the well-being of our healthcare professionals. As many folks, next slide, please. For some reason, this isn't working. As many folks have already talked about today, the theme about burnout. The way that it was showing up for us was in the space or the area of just our team dynamics. I was called in to work with a group of nurse leaders in our cath lab that were struggling with incivility. There was some peer-to-peer conflict, and there was also some reduced cohesiveness. And so what it matters is obviously it affects everyone's individual well-being, but also it was really having a negative effect on our high-functioning team dynamics that we were working toward, and ultimately workplace culture as well as patient care. And so what we came up with is a novel way of doing it. And it's something that I did in my personal life before coming to Mayo Clinic. And I thought that it might be a great application there. And so fortunately, the nurses who I work with, they felt that it could be helpful too. Oh, there we go. Oh, can we go back one, please? Oh, okay, great. And so as I mentioned, part of that is we wanted to integrate it into the clinical practice. So I think that's a unique characteristic of this particular intervention that we did. Next slide. Thank you. And so in May of 2021, so this is a year after really the pandemic was pretty much full force, over the next 9 months, we enrolled 227 physicians and non-physician healthcare professionals at Mayo Clinic, and these are some of the subspecialties that participated in our program. We assessed everyone with the pre and post validated well-being surveys. You mentioned one earlier was the WHO Wellbeing Index. I think Mandeep used that one in his study too. The Wong La Emotional Intelligence Scale, as well as the Professional Fulfillment Index. And with each department, participants were presented the core components of the practice, which I'll go into next. And there was a daily 15-minute intervention that everyone who enrolled participated in. In addition to that, we had bi-weekly meetings, and that was over a 3-month period. Next slide, please. Great, thank you. And so I want to spend a little bit of time about what our well-being practice was. The first one is we performed a gratitude exercise. In the conversations that we heard in the morning, a lot of people talked about the merits of gratitude. I was a person who came late to realizing how beneficial gratitude was. I really minimized it, but I had a personal hardship that occurred for me in my relationships, and as a result of that, I sought out gratitude. And the way that we performed it at Mayo Clinic was we named 5 things each day that we were grateful for. My suggestion is that you pick people that in some way had a very positive impact on your life that day. And then the next thing we did is we read 1 page of the Mayo Clinic Guide to Stress-Free Living book. Another full admission here is that when I received this book about 2 or 3 years earlier, I minimized the book. I guess that's part of my negative bias. I read the book. I thought the title was quite ambitious. And second, I didn't understand how a cartwheel was going to change my life. So I didn't read the book for about 3 years. But once I went through that breakup, I couldn't find the book fast enough. And so I'll tell you just a few things out of the book that really resonated with me. And being somebody who had a superpower, which at the time was being a complainer, I complained with the best of them. That I knew that I needed to make a change. And so the book really informs how you should approach communication. And one of the passages in the book says that your words, before you speak them, should pass through 3 gates. The first gate, is it kind? The second gate, is it true? And lastly, is it necessary? And what was clear for me was that most of what I said wasn't kind. The truth was subjective, and hardly any of it was necessary. So for the work group that I mentioned before in the cath lab that I was working with, where there was incivility and there was a toxic culture, part of using this as the mechanism to determine whether or not you should be talking to other people or how you should approach conflict, this was very useful of people really doing an assessment of themselves first before they spoke of, is this kind, is this true, is this necessary? And that seemed to help. Additionally, something else out of the book really informed the way I came to work, and others did too, is the author tells a story about this collection of tribes a long time ago that had a single leader. And one day, a nomadic tribe moved into the same region, and they had a leader. The leader of the collective tribe sent over a messenger with a bowl of milk. It was so full that as the messenger was walking with the bowl, the milk was spilling over. They delivered the bowl to the leader of the nomadic tribe. In her infinite wisdom, she recognized that what the leader of the collective tribes was trying to say is that all our resources here have been spoken for. You and your people need to find other places to settle. And the wisdom of the leader of the nomadic tribe, she scooped up a handful of sugar and she dropped it into the bowl to say that we will take nothing from this land. Instead, we will sweeten it. And they went on to become the most prosperous tribe in the region. So the way that I try to go into Mayo Clinic and people that have performed this practice committed to was that every time they walk through the door, that they're not there to take one thing. They're only there to give. Patience, obviously, but also to give to each other. Next, we would read 3 to 5 minutes. We would do 3 to 5 minutes of exercise. I know that's not cutting it for the ultra athletes that we had in here this morning, but that would be in the form of stretching. We would listen to an inspiring podcast or faith-based talk. What you notice there is we didn't listen to the news because I mentioned I was a super complainer, so the news was a problem for me, so I stopped listening to the news over this period. And then lastly, there was an accountability feature that was also a part of it, in which every subspecialty group that participated, they would send out a text or post that they had completed the practice for that day. So the accountability feature was also something that was very effective. So that's part of the individual part of the practice, but there was a collective or group component that we also found helpful, and that we would meet virtually and in person, and we would have all the leaders be a part of this, as well as the staff. And we'd answer 2 questions: what's going well with your well-being practice, and what needs work. Some of the common answers for what's going well included, my capacity for gratitude has increased. Some of the things that needed work was my ability to handle change. And as a result, we'd be open and we'd be vulnerable, and we'd offer wellness-centered feedback. Next slide, please. Thank you. And so some key insights from this is that we saw significant improvement across most well-being measures that include emotional intelligence, professional fulfillment, as well as a decrease in burnout. We saw this sustained not only at the 3, the 6, and 9 month, but a year later, people were still feeling the positive impacts of this. And we had people say that they experienced greater empathy from team members participating in the biweekly intervention. The biweekly meetings. So another key insight was not only did we have leadership support of the program, our leaders actually participated in the program. And the doctors were all, and all of the people with these sophisticated titles, they were all on a first name basis. And so we were able to break down some of the hierarchy so people could be really vulnerable with each other. We integrated the meetings into the workday, so we stopped asking staff to come in early to do a nature walk or to stay late to attend a yoga class, but it was actually part of meetings. So imagine before you have a meeting talking about access to calendars and how are we doing with revenues this year, but we started the meeting off with a gratitude and appreciation for each other. Be a different kind of meeting. And then lastly, we saw that that improvements were sustained beyond what has been observed in traditional individualized interventions. Next slide, please. So these quickly are a graphical representation of the results from our intervention. Next slide, please. Thank you. So why it matters? It matters because of what we talked about today, which is burnout still is a problem that needs to be addressed. Some of the implications are that by integrating something like the practice into existing work meetings, healthcare organizations can positively impact their culture, staff well-being, and teams. And lastly, prioritizing wellness-centered leadership would be a great aspirational goal for all of us. Next slide, please. And so, call to action, develop wellness-centered leaders. Meaningful, redesign one of your standing meetings right now to include and prioritize well-being. And lastly, make group connection, the human-to-human connection, a priority in your workplace. Thank you.
Thank you.